Today's webinar is focused on CVI, a brain-based visual impairment that is often underdiagnosed, and if not properly addressed, can have lasting impacts on vision. We're fortunate to have presenters Rachel Bennett and Mahady with us today. Both are parents and leaders at CVI Now, a program at the Perkins School for the Blind. Welcome, Rachel and and thank you for joining us today. I'll now turn it over to you.
Wonderful. Thank you, Jackie. Hello, everyone. Thank you for joining us and taking time to be here to learn about CVI. I'm going to change to our slides, and we're excited to dive in. Does all look good? Yeah, great. So this is such a great way to close out the year to be with the ARC community. The ARC means a lot to me as a parent of a child with disabilities. No matter what state I've been in, the ARC has always been a resource for us. And we're really excited to join you and be with you in community and talk about the leading cause of blindness and low vision. So I'm Rachel Bennett. I'm the director of CVI Now, which is a big comprehensive website about CVI. We're here at the CVI Center at Perkins School for the Blind. I'm also a parent to Henry, who has CVI and other disabilities that include autism and intellectual disability and many others. He's in middle school, just started this year, and it's been a wild ride. And Allie, go ahead.
My name's Mahady, and I manage outreach and engagement at the CVI Center with CVI Now. And similarly to Rachel, I have a little boy named Weston. He has CVI and other disabilities as well. We're very involved with DDS and the ARCs. We're really excited to be here and talk about CVI with everyone.
And so we're going to go through what is CVI, the current research, what we're hearing from people with CVI. Please use the chat to ask any questions that come up. Me and Allie will try to answer them, but we're also know that we're going to have a Q&A after our presentation. So yeah, we're going to go through what is CVI, when to suspect it, the challenge of getting a CVI diagnosis, what we're learning from adults with CVI. We're learning so much, and it's really helping us broaden our understanding and move the field forward. What are some general supports and adaptations for people with CVI and resources and support, and then we'll have a discussion. So CVI is the leading cause of childhood blindness and low vision, and it's often misunderstood and underdiagnosed. We have a lot of data in the pediatric space, but we know if it's a leading cause of childhood blindness, if we extrapolate to adulthood, we know that there's many adults out there with undiagnosed CVI. A recent study in the UK found that 1 in 30 kids in mainstream classrooms have some type of CVI-related visual difficulty. That's a high number, it's a high prevalence. And so we know that CVI is much more common than we think. We did a recent study with McKinsey & Company here in the US, and they found at least 180,000 kids and young adults with CVI. We know that's a really, really low estimate because we don't have a nationalized healthcare system to be able to find all of our patients. But within that data, less than 20% of kids and young adults with CVI in the US are diagnosed, and that's a really low number. And so we're missing so many people with CVI, and so many caregivers of people with CVI don't know that their child has CVI, and I was one of them. Henry's CVI diagnosis was missed until he was 5.5. And there's others that they don't realize they have CVI until they're 15 or 23. We get adults come writing into CVI Now that say, like, I'm 34 and I think this is what I've been experiencing my whole life. So we're really at the precipice of understanding this emerging crisis. So CVI is a brain-based visual impairment. We really see with our brains. The eyes just take in the information. And this is an functional MRI image of our brain's visual pathways. So it looks like most of the brain is really helping us understand and visually process the world around us. And this is from Dr. Latvia Marabit, who's here in the Boston area, leading researcher in the CVI field. And here is an fMRI image of a person with CVI. And you notice the difference in connectivity. And CVI really is impacting the brain's ability to visually process the world around you. And so with CVI, the brain has difficulty recognizing and making sense of the visual world, and it impacts every aspect of life. You can have 20/20 vision, but also be functionally blind with CVI. Many with CVI also have other eye conditions. And so going through some different aspects of the definition, it's a brain-based visual impairment caused by damage or interruption to the visual pathways or visual processing areas of the brain. It's characterized by functional vision problems that can't be adequately explained by a structural problem with the eye. So you may have a normal clinical exam, but when you function in the real world, you have trouble going, navigating curbs or depth or going up and down stairs or recognizing people. And we're going to talk more about how CVI manifests. The visual centers of the brain just have difficulty processing and interpreting visual information. And individuals with CVI struggle with visual attention, being able to look at something, visual recognition, being able to know what you're looking at. And this just results in a lack of access and understanding of the world around them. And all manifestations of CVI are significant for the person. Yes, we will share the slides. I'm just seeing the chat, so don't worry. I do want to share some really exciting news. Was it just last month, Allie? Right? The National Institutes for Health released a new CVI working definition, and this is huge, right? To have CVI be recognized by a federal agency like the NIH. They're also creating a CVI registry, and where the CVI Center here at Perkins is doing a lot of work with them as well. So we're really, really excited. And I know this is kind of a lot of language, but I just kind of wanted to reiterate it here because, this hopefully brings more awareness to the medical community and can lead us to a more agreed upon diagnostic process. And Ali will speak a little bit to why diagnosis is a challenging piece right now. So it encompasses a spectrum of visual impairments. It's really neurodevelopmental conditions. It's a spectrum of manifestations caused by an underlying brain abnormality. It may not come up on the MRI. My son's MRI doesn't look like he has the brain-based visual impairment. For some, it does, right? It's where imaging is right now. You may not even see it. It can't be fully explained by any other ocular conditions, and it affects lower order. So lower order visual processing is like the clarity of vision and color, being able to see differences in color and tracking. Higher order visual processing is the recognition piece, is visual motor, is visual spatial, all the different processes that help us really engage fully and take action in our visual world. It's not a primary disorder of language learning and social communication, right? We have other diagnoses for that. It's very much a visual access diagnosis, but it also may go unrecognized or undiagnosed until later in life. And that's why we're here, that we know that there's so many people living with CVI and don't know it. It can look like many other conditions. Like autism, it can look like ADHD. It has a lot of different overlapping behaviors. It also commonly associated with so many other conditions. CVI and cerebral palsy are really they come together up to, we have 65% from our McKinsey data that we did, but in other research articles, it's up to 70–80% of people with cerebral palsy might also have CVI. Epilepsy is really common in the CVI population, developmental delay, autism and CVI co-occur together as well. And we're learning a lot of new data around autism around visual processing dysfunction. And a lot of other genetic anomalies and rare diseases are also associated with CVI. My son has an extremely rare genetic variant. I know Ali's son is also part of the rare disease community. A lot of different, anything that impacts the brain is going to have a risk with CVI. So lack of oxygen or meningitis or brain injury or stroke. So CVI can be acquired, if there's an accident that involves an impact to the brain. And it also can co-occur with other ocular conditions as well. So I'm going to slow down and get really excited and talk really fast about it. So when we think about how CVI manifests and evaluate really the impact of CVI, we look at what's called CVI visual behaviors. And I know this is a lot on the screen right now with this image, but this is here at Perkins. We have a whole framework to look at how does CVI impact access in the environment, impact access to learning, and impact access to develop and learn a whole wide range of skills. And so we have these 16 areas that we use to assess and evaluate. We just released a brand new assessment called the CVI, the Perkins CVI Protocol, which is a comprehensive assessment that evaluates CVI's impact on access in all areas. And we look at visual attention, being able to look at things. We look at the ability to recognize visual aspects of the world. And all the other areas are kind of impact those two skills. And so we think of many with CVI, they're not able to process motion, or like fast moving cars or swings on the playground. Clutter is a huge, huge issue with CVI. So the more that things there is to look at once, the less it impacts the ability to use vision at all. And Allie is going to share some examples of what those lived experiences are like. It's hard to recognize people, to recognize things at a distance. It's hard to use vision when there are other competing sensory inputs, like when it's noisy, when it's really hot out, when there's lots of movement. Visual motor skills are impacted, visual field ability, so being able to, maybe a left field is impacted or a lower visual field as well. And also just being able to look at two-dimensional items. And you think about so many things in our world, in our education system, in our adult care centers, so many things are in 2D as well. And so people with CVI really require a multi-sensory approach to access and learning, because they all create compensatory skills for access. So using context, using memory, using predictability. For example, my son, we have a red dot where he puts the remote under the TV. And if the remote is not there, it's completely gone to him. It's really difficult for him to search around the room. Color coding is a huge compensatory skill because the visual world is unrecognizable. Color is a relative strength. And so people with CVI use color to recognize things. Tactile skills, smell, auditory cues, and using verbal cues and labels to help people understand what's around them. And so,
Rachel, can we just pause for to
Yeah.
see? I know the ARC can't see the PowerPoint, so I just want to make sure that everyone else can see the PowerPoint.
Oh,
If you can't see the PowerPoint, please let us know in the chat and we'll check it out.
can you see it, Allie?
I can see it,
Okay.
yes.
Okay, great. Oh, we got confirmation that somebody can see it. Thank you. How many years have been using Zoom and we still don't trust it? It's okay. It's okay. Let's always keep checking. And so, given how CVI is common in so many other conditions, right? Maybe you're a caregiver of an adult who you're noticing has never really used vision in a way that is expected, or they're showing some behaviors that you just can't fully explain, even if it's a young adult or a teenager or older child. What are some things that can help, that will support, maybe your hunch and suspicion of like something's not right with their vision? Well, there are some red flags. It prevents differently for every person. And so in order for an individual to be diagnosed, like I said, symptoms can't be explainable by other eye health conditions. And so think about, does a patient have a common cause or co-occurring condition of CVI? Is there a history of visits with neurology, right? A history of developmental delays? Is there concern about how they are or not using their vision? And thinking about, does the individual, do they look at things differently? Do they have trouble looking at something that's pointed out at a distance? Do they tilt their head in a certain way, in a certain position to see something, right? If they're watching TV, do they do it in a certain way? Are they upside down when they're engaging with food or a toy? Is it always kind of on one side? Do they notice something only when it moves or light up? Movement can be a relative strength to notice something. Also, lights can be for some with CVI. Does their vision appear inconsistent? Like, for example, at night when they're really tired, do you just kind of see them not using their vision at all? Or do they appear to touch or listen before showing visual interest? My son is such a tactile kid and he needs to touch everything before he even attempts to use vision. Do they have trouble finding things or recognizing objects, right? Not notice new items presented in front of them. If they've never seen it before, they're not even able to recognize it. Or then they only recognize well-known items in very familiar settings, but not outside of this context. Have a hard time recognizing two-dimensional images, pictures, print. They lose things that are dropped on the ground. Trouble finding things that are a new or a cluttered spot. And clutter can be two things for somebody with CVI, or it could be just kind of normal clutter, for example, on your kitchen counter, and not being able to find, something that they're looking for. They may miss things in certain visual fields or need verbal cues to find something, or they use color, touch, sound, and memory cues are the main supports for knowing what something is. They might have trouble at meals, like finding food on their plate or eating in a busy environment. They might struggle with learning or routine tasks, appear to have a short attention span or not seem interested in learning, difficulty with cluttered spaces or learning materials with visual clutter, like all those worksheets. Reluctant to join a group or participate if it's noisy or loud. Even routine tasks at home, like brushing teeth or cleaning up after their meal. All of those ADLs that we work on with our kids and adults with disabilities, if there's even after repetition and direct instruction, if they're still seeing difficulty with those tasks, vision should be considered. They might have trouble interacting with people, right? Mistake a stranger for a family member, especially if they have similar traits. Before I knew my son had CVI, he never recognized me when I pick him up from school or daycare, and not until I said something out loud. Even to this day, if I'm sitting in an unusual place in a room and I'm not saying anything, he'll not know I'm there. So sometimes it works in my favor, sometimes not. Only recognizes someone when you hear their voice. They have trouble pointing out familiar people in photos. They might not return a smile, may have trouble making eye contact, or miss gestures like a high five or a handshake, or even just miss expressions and body language, and not understand why your voice change means that you're angry, right? Or sad, or not be able to find somebody in a group of people. They might tire easily, rub their eyes, put their head down, get fatigued and irritable after using vision for a certain amount of time, overwhelmed, upset, meltdowns in new or loud, busy places. And a lot can cause overwhelm and overstimulation for, for this population. But I think it's important to understand the why behind it, right? We always want to understand the why behind behavior. Overwhelmed when there are too many things to look at, appears overly tired at the end of the day. Visual fatigue is common, just like not wanting to use their eyes or shut down, put their head down a lot. If they're in a new busy place, I see many just kind of put something over their head or something like that. They might need help navigating spaces. So they trip over clearly visible things or bump into furniture. Go in front of moving objects, not know familiar routes, trouble moving through crowds, trouble with change, like a sofa in a new place or a different colored rug. They have difficulty going down ramps, if they're a wheelchair user, or steps. You'll see a lot of hesitation with these changes in the floor surfaces. If they're going down steps, do you see them dragging their heels or pausing or tapping their toes or really relying on that railing? There's a question that I want to address right now. How do you distinguish CVI not recognizing people from propopasognosia, which is just face blindness? With CVI, that face blindness is a part of other visual behaviors that you're seeing. So if you're only noticing that somebody is not able to recognize people, but they're able to use their vision in all other aspects and areas of life, then you can bring it down to face blindness. But CVI, you see all these visual behaviors manifesting, or most of them at least. And I'm going to pass it over to Allie now.
Thank you, Rachel. So I'm going to talk a little bit about challenges of getting a diagnosis, which I know Rachel kind of touched upon a few already, but we'll go into it a little bit deeper. If you want to go to the next slide. So as Rachel already said, it's definitely largely underdiagnosed. That study that Perkins worked with McKinsey and company found that less than 20% are being diagnosed. And that study was only ages 0 to 22. We didn't have the data at the time for beyond that. So we know we're hearing from lots of adults and lots of adult caregivers that they do not have the diagnosis, but they're starting to suspect it. It's also very poorly understood. I mean, as you can see with all these 16 visual behaviors, it's complex and every person presents differently. So it can be challenging to say CVI looks like this because everyone really has their own interpretation of how CVI is for them. There's also no agreed upon diagnostic medical evaluation, which makes it very challenging. So to find a provider who is really experienced and comfortable diagnosing CVI for that reason. And that's kind of why we're super excited about NIH having this working definition, because the hope is down the road, hopefully in the near future, there will be some diagnostic medical evaluation that's agreed upon. We're fortunate to be in Massachusetts, but still, even in Massachusetts, not all doctors are familiar with CVI. We see kind of a subspecialty of doctors who are comfortable with it, and we're creating a doctor directory for that reason, for individuals to go to our site and find a provider that is comfortable diagnosing CVI. But it's still something that's just not everyone is super comfortable diagnosing yet. Especially with medically complex individuals. Like my son, for example, has a lot of different diagnoses, and sometimes those overshadow his CVI. So, for example, he has epilepsy, and some of his behaviors, people might think they're due to epilepsy, but it really is due to CVI. And I know Rachel already talked about like autism and ADHD. There's definitely that overlap there. So it can be very confusing for providers to kind of diagnose it or even spot it. And so you really need somebody who, with the trained eye, to understand all of these visual behaviors and kind of go from there in terms of diagnosing in order to get the individual services that they need. So those are just a few of the challenges and barriers that someone with CVI kind of has to go through, unfortunately.
I do want to say that here in the Boston area, we do have many who can diagnose CVI.
Yes, we do. Yes. So I'm going to talk a little bit about the lived experiences, which is one of my favorite sections. Perkins has talked with different individuals who have CVI, and we were able to recreate images of what CVI looks like to them, which I find so interesting because we really can't say for certain what it looks like. And these individuals are telling us what it's like for them. And you're able to see how it's really different for every individual, which I find so interesting. So what we do know about experiences is that vision is affected by both internal and external stimuli. So it could be things like seizures or medication or fatigue, or it could be external things like Rachel mentioned, like clutter or sensory input or heat. We know that vision is hard work. That's kind of why we see individuals at the end of the day, for example, having visual fatigue. It's very hard to work on vision all day long, and it can be really unreliable. We also know that, and I think she talked a little bit about um, people using different sensory channels, but yeah, vision is just one. We can use other non-visual skills as well, and most individuals with CVI do. I'm thinking of my son. He uses touch quite a bit. We're starting to realize he uses his smell quite a bit to determine like what's in front of him for food instead of visual. So it's not uncommon for CVI individuals to use all these different sensory channels in order to kind of see the world around them. So we're starting on some of the images that Perkins recreated based on individuals' experiences and them telling us what it's like for their CVI. Nye is an adult with CVI, and they're saying that information is landing on their eyes but unable to make sense of it. So light or certain colors may enter their awareness, but determining where one object ends and the next begins is difficult. So we've created this image to kind of portray how Nye is seeing, which if you go to the next one, you'll see is a completely kind of different story. Well, actually, I think she has one more quote next. Oh, no. Okay. So Dagbert is another adult. And when she's visually fatigued, it's comparable to looking through a straw. So very different than what Nye was seeing. And so what we're seeing here is that kind of coming back to that diagnostic challenge, like individuals have very different experiences. So if a provider is not really understanding CVI very well, it's kind of very hard for them to actually know what to look for CVI. And this is Dagbert again saying, this sums up how I see when I'm in a new place, which is just, for me, I'm not sure what I'm looking at, so I can only imagine. Yeah. Okay. And Tina is another adult who we've connected with quite a few times. And I'm going to read this quote from her. She's an adult with CVI. She's saying, sometimes I can see and my brain can decipher and process what I'm looking at using compensatory skills. Other times my eyes see, but my brain refuses to decipher and process what I'm looking at. I also struggle every day with facial blindness. In general, it's hard for me to process where I am, what I'm doing, or who I am with, since people in the world around me are blobs of color. It's very disorienting to experience the world like this. And so this is kind of, an image based on what she's telling us. Same thing, very different from the first two. Go ahead. Yeah, you can go to the next one, Rachel. One CVI person has talked to us about heat, which is something that we're hearing more and more about, saying when it's hot out, he receives reduced visual feedback from his brain, which we actually have a whole article on heat and CVI. So it's really interesting. And so this is us recreating an image when it's hot out, what it looks like for that particular person. And Krish talks about his lower visual field loss, which means he's not able to see below eye level. So again, showing none of these experiences are similar. And so they're all very different. Every individual is seeing something a little bit differently in a different way. And Omar's talking about not recognizing faces and facial expressions. It's really hard for him, and this is something my son has as well. We noticed it early on with him when he was a baby into like 2 years old, sleeping in a crib. We would walk in quietly into his room, and he wouldn't make any like facial expressions or noises or anything. And as soon as he heard our voices, he would smile and squeal and make lots of fun noises. And we're realizing that he actually doesn't recognize our faces. It's our voices that he's recognizing. So this one's not uncommon. And another person talks about the use of color as a way to recognize particular objects or people. Same thing again, this brings me back to my son. My husband wears blue jeans, and every time he sees an individual with blue jeans, whether it's male, female, stranger, new person, he grabs their leg because he thinks it's dad. So that's something we're very familiar with here. So I'm going to talk a little bit about general supports and adaptations for CVI. So what do you do for somebody who has CVI? And there's not a one size fits all, because as you can see, every person kind of has their own visual, those pictures were very, very different, but these are just kind of some general ideas that we can start with and people can explore. So what would an accessible day look like for somebody with CVI? When we talk about this, we're talking about like how would you adapt spaces for them to be accessible for someone with CVI? And it's going to be, like I said, different for everybody, but there are some common things that you can look into and making daily routines and tasks accessible using that multisensory approach. I mean, we've talked about, my son, for example, using smell and touch and different forms of senses other than vision. What are ways to implement proactive breaks? We see oftentimes that individuals need movement or regulating breaks and activities. And how can the team or the caregiver make activities and experiences meaningful and accessible? Multisensory approaches, we're talking about this, but like auditory input, reinforcement, praise, like hearing that sound if vision isn't working properly or, visual fatigue's kicking in, hearing a voice might be helpful instead. And how can the team be more proactive and intentional about total communication and social interaction? We find, I'm thinking of my son, like he's a total communication type of kid. He uses all senses to communicate with us. He uses touch, he uses hearing, he uses smell. Sometimes vision comes into play. Sometimes, more often than not for him, that's the one that's the least used. So kind of going into all of these things, and you can think about what might an accessible day look like for your child. So these are just some general recommendations. I keep saying that because it's not, unfortunately, we can't give you a list of here's the answers, but it is individualized. But here are some, things that we can talk about. We've talked about the multisensory approach. So that is where we're talking about, visual, tactile, auditory, other options for individuals with CVI to explore their world. Adapting accessible learning materials. So as Rachel mentioned, lots of times individuals with CVI also have other ocular conditions. So whatever that ocular condition is, for example, my son doesn't see well above eye level. He sees very well below eye level. So we present all the materials below eye level for him. So you want to present materials in the proper field, depending on what that individual's preferred field is. Allowing individuals to focus on one task at a time. It can be very overloading to ask an individual with CVI to do 2, 3, 4 things at once. So things like, if the individual's working on sitting and you want to do a visual activity, like have them supported so that they're not focusing on that muscular strength of trying to sit while also doing a visual task. Reducing visual clutter and crowding, as Rachel mentioned. Clutter could be just 2 things. It could be a whole kitchen counter, but reducing it and having the individual focus on that one item can be very helpful. And using intentional color and color contrasts to highlight whatever it is that individual is going to be focusing on or trying to learn is that can be very helpful. We've talked about a little bit the use of light and backlight devices to support visual attention and recognition. And wait time is really also a big one. I think I remember from my son, we we've done some evaluations and we're told to wait 10 seconds for him, for example. Like that's what he needs. You present him with an item, he needs 10 seconds to kind of absorb it and kind of, touch it, feel it, understand what it is before really going into anything else and allowing him that time. So now we'll go into a little bit more specific examples so you can kind of see what we're talking about. So when we talk about reduced visual clutter, if you look at the top picture, she's trying to show an individual a book, and there's a fish on the book, but there's lots of stuff going on in the background. Whereas when we talk about reducing visual clutter, we're talking about just have that one item. Oftentimes you can use something simple like a black sheet, a black piece of paper. It doesn't have to be black, something just contrasting so that we're highlighting just that one item and blocking out all the other items. And I talked a little bit about supportive positioning, but if an individual has to work on sitting or whatever position they're going to be in while also using the vision, it's now taking extra strength for them and extra work for them. So having that supportive position takes away that one thing for them, and they can just focus on vision and presenting those materials at the visually accessible field. So whatever that visual field is, my son's is lower, sometimes other people's is right or left, or wherever that field is, you want to present the materials at their preferred field. And intentional use of color. So if you see some of the pictures, like the top one is just using a little piece of red tape to highlight a stair or a curb or a handrail, something to kind of make it stand out. I know in my home, my son learned to do stairs once we started highlighting the staircase. Our stairs they all have red tape on them, and that's something that he needs in order to actually access the stairs. The one to the right is something we've used as well, where we just have a black placemat and one usually solid color, bright colored bowl or plate on top of it to highlight mealtime. This is food. I think this next one might be, is this Henry's? I'm not sure. The remote. I think Henry's has these little great silicone pads that he uses throughout the house to put whatever it might be, whether it's the remote or glasses or, anything at all, just to kind of highlight the color contrast so he can see it better. And then things like light switches or whatever the item might be, just highlighting it with, it could be, shiny tape, glittery tape, red tape, yellow, whatever you have or can get your hands on. Dollar store has a lot of these things just to highlight it for the individual to see better. And intentional use of light. So this top photo is just showing, we have a black background, kind of reducing all the visual clutter, and we're highlighting that one object for the individual to see. And below is just the backlight. So iPads are something that we see oftentimes individuals with CVI do see well with. I know my son, for example, gravitates towards that iPad, and it's something that he can just see very differently than without that backlit. Okay.
I just want to note that my son hates the iPad and backlighting. So it's just, you never know.
Yeah,
He also has a mild photophobia and light sensitivity, but.
Yep. And reduce noise, movement, and distractions. This is a big one for my son. For example, like if we wouldn't be able to take him out in public to a restaurant to eat, he would not be able to focus on that task. The noise is just too much for him. So if you want to focus on a learning task or on something in particular, it's very helpful to reduce that noise, all the other distractions. So if, people are running across the room, that might be not the best place to present learning material. For example, holiday parties can be difficult if they're large and crowded. And so just kind of preparing for that. Like if you're going to a big holiday party, is there a quiet space if the individual needs a little break visually? Okay. And multisensory approach, again, we're talking about this. I mean, there's different approaches listed here, like music, for example. My son communicates quite a bit through music. You see him smile, you see him jump, you see him sway. He also has some of those buttons that you press to communicate where he's telling us his needs or he feels different things. I think Henry's a Braille user, right, Rachel? Like everybody has different senses that they prefer. And so that's really important for CVI to explore all of those senses and what is preferred. Not everybody, for example, likes to touch things. Some kids or adults don't. So you kind of just want to explore and find out what is the preferred method for that particular individual and use that. So what are some next steps? So if your child or adult has CVI or suspected of CVI, or now you're thinking, I want to explore this, what do you do next? So we'll talk a little bit about that. So one thing would be to be referred to a doctor to see if you can get the diagnosis or just evaluated. Neuro-ophthalmologist, optometrist, and oh my goodness, ophthalmologist all diagnose, and some neurologists do as well. We do have a list on CVI Now of doctors who have agreed to be on there, who are comfortable diagnosing. And it's by state, which is wonderful. So if you're out of state, we have, different states that have doctors. I don't know if we have all states yet, but that is our goal. If you are an adult with suspected CVI, you can be referred to the DDS Collaborative Eye Care Clinics. There are 3 in Massachusetts. So that's a way to, be referred right there. And those doctors should be more familiar with CVI there. Once at the medical clinic or provider's office, they will check for eye health and eye conditions. And as Rachel mentioned early on, CVI can't be explained solely just by an ocular condition. So they will check for that, and they'll check for eye health and other vision problems. And one thing we always like to remind families to do is to take some videos of your loved one or your child or adult before you go to these appointments, both in comfortable locations and locations that maybe are new, to kind of show what their vision is like. Because when you go to these appointments, you might only get, I don't know, an hour or so there, and that's just a quick snapshot for the doctor to see. So it can be really helpful to show different snapshots of their vision and how they use it in different locations. And so if suspected, the care team, whether that is, the care team can mean multiple different things. So if we're talking about an adult, for example, the care team can refer to, so Mass Commission for the Blind and DDS have a collaboration of orientation and mobility services. It's available in the state of Massachusetts, which you can absolutely refer there, even if you don't have a diagnosis of CVI and you just suspect vision. That's something that you can refer, and they can evaluate the individual. Right now, there is a need for CVI services for the adult community in Massachusetts. It's wonderful that they have the O&M services. Right now, teachers of students with visual impairment really work with school-aged children, so we're not seeing that happen for adults right now. But that's something that I think we're all willing to explore for the future and see what options are out there. If you have a child and they are in the school system and the IEP age, you can request evaluations and services through TVI, an O&M, and an assistive technology specialist. And if you have a really young one, you can do early intervention request services through them. And so at CVI Now, we have lots of resources for families and for individuals and caregivers. We are a big support system. I like to say we're the go-to place for CVI for people to come to and ask their questions and get the support they need. We have a parent caregiver Facebook group, which has, I think, close to 3,000 members now, and there's lots of discussion, which is wonderful. It's a really safe space. It's run by our parent community manager, who is also a teacher of students with visual impairments and a mom of someone with CVI. She also offers, which I think is just one of the best things we offer, a CVI parent caregiver support one-to-one session. So for example, if you have questions about your child or loved one and you want to talk to a teacher of students with visual impairments, you can set up a free one-to-one session with her and ask her, all the questions you want or discuss things with her. We have lots of articles. We have, things like the doctor directory is really wonderful. Just articles like what is CVI? We have an educators hub. We have a whole section on what are the signs of CVI in adults and understanding the visual behaviors and assessments. We add webinars and lots of things all the time, so it's constantly growing. And we do have lots of things going on right now for CVI with adults. It's something that we've started compiling lots of different articles. We've interviewed and met with lots of different adults who have CVI and have explained what it's like for them. They've shared their stories, which is wonderful. And so this is something that, we're starting to compile a whole section for adults. And we do have, as Rachel mentioned, the Perkins CVI protocol, which launched about, I don't know, I'm going to say about 6-ish weeks or so ago. It is a comprehensive and inclusive educational assessment tool for individuals with CVI. And it is an expert evaluation tool designed for teachers of students with visual impairment. but it's something that is downloadable and free and customizable, and students and parents and anyone can download it. So it's something that anyone can look into and kind of just familiarize yourself with what is the assessment like. And Rachel's talked about those 16 visual behaviors, and that's something that this is based off of. At Perkins, there's also a transition center. So there's lots of different things that they offer, such as college readiness, life skills and independent living, planning and career exploration, and employment prep. And they too also offer one-to-one transition services. And I believe they also have a similarly, like a Facebook group as well that we can, that is on their site. Rachel just sent that, and they have community talks as well. So that's a great resource center as well. And so some of the resources for adults offered by the collaboration between Mass Commission for the Blind and DDS are those orientation and mobility services. There's those collaborative eye clinics, which there are 3 in the state. They offer virtual caregiver support groups, and they offer free focus talks, which are free on-demand sessions. So they're pre-recorded and you can watch them at your own leisure. And another thing that we have on the CVI Now site is just a quick double-sided one-pager on, what is CVI and when to suspect CVI. And it's, it's just a quick read. It's something that you can print off if you wanted to. It's downloadable. And, if you click the link below, you can get to that article on adults with CVI as well. And that is really it. So we want to allow time for you guys to ask any questions you might have. We know it's a lot of information and it might be new to some of you. So we want to allow a decent amount of time for some questions and answers.
There were lots of questions in the chat. So there's one about literacy, and one about, Rachel, what helped you decide that Braille was appropriate for your son? So I want to just go back to a question, I don't know if everybody saw, from Lucy, like, can individuals with CVI learn to read? Absolutely, right? People with CVI can learn to do anything they want, as long as they have the appropriate access and accommodations. And so some of CVI are print readers, but that means it may need to be heavily adapted, right? Maybe they need some color coding in there. They need to take away extra clutter. Maybe they only are able to read digitally. Maybe they need larger font. There's a lot of different adaptations for print. But most people with CVI are dual media learners, meaning they need multiple different formats to access the information, because visual fatigue is probably one of the most common experiences among people with CVI. So for example, there's this one print reader who says, after 2 or 3 paragraphs of reading, it feels like my eyes are being pulled out from their centers. I'm like, well, that must be painful. But so she's a voracious audiobook reader. And so audio is a huge, many with CVI use, audiobooks as well, but also many use Braille. The decision for my son to use Braille comes from an assessment called a learning media assessment that TVIs know how to do for school-aged students, and it looks at how does the learner use different sensory channels. My son really prefers his tactile sense. He has some vision, but it's really extremely fatiguing because he also has other co-occurring ocular conditions as well. And also in general, some of his other chronic conditions increase his fatigue. And so once he's tired, vision is the first to go, but his tactile is always there and ready. And so that was the decision to help him learn Braille. He's still a print reader. He needs 60-point font. He needs blue text, right? Black is not accessible, but blue is. This is the wild thing about the color. And, this CVI is just endlessly fascinating like that. And it needs to be kind of like one word at a time, spaced out in a black background. His TVI makes these really great adapted books where he has, they're first of all rooted in experiences that he knows really well. Like he loves riding the MBTA, he loves riding the trains. And so he's working on learning all of his words and stuff using that very, very, very familiar life experience. And so he has a picture, a real picture on one page. There's a tactile component there. Then he has print, and then on the next page, and then underneath the print, he also has Braille. So no matter how he shows up each day, he has a way in and access in. But it's also, it's really hard for him to learn. And so it's not like he's a proficient Braille reader right now. He's still very much learning. But once he started using multiple methods of literacy, he started to see himself as a reader. So we'll see where it gets him. We'll see what happens.
I have a quick question.
Mm.
So you had for the assistive tech for people coming in and maybe looking at someone's home or living environment. Do you guys have assistive tech people that specialize in CVI that can kind of come in and check the surroundings, or how would you find somebody that?
Oh, that's a great question.
'Cause
Allie?
the suggestions you had were really great. So it'd be nice if like somebody could come in and kind of,
Um, I don't think I'm not sure through Perkins, but I do believe like through Easter Seals, I think they can do an assessment, I believe. Don't quote me on that. If your child's school aged, you can ask the school for that. If your child is not school aged, I do believe, Rachel, are you aware of that Easter Seal program where they hand out?
yeah,
No.
I guess so. He's an adult, and I guess it's I'm familiar with the assistive tech people, but I'm wondering if there's anybody that's like very specific to like
Yeah.
CVI and the visual part that you guys know of.
At UMass Boston, Allie Fuddy, we're going to be putting out some new assistive tech videos from her on CVI Now. But she works at the UMass Boston Vision Studies program. She's incredible when it comes. She's an O&M instructor. She knows CVI really well. But she generally knows assistive tech CVI well. And she's an adult herself living with low vision. So she's really great. Yeah.
Are you involved with DDS at all? Are you
With
involved?
DDS?
Yeah, because DDS has the DDS collaborative with OCM people involved in there, and they do the whole thing with the oh my God. With the visual holds. I just lost my train of thought there. But anyways, they have a whole collaborative, and the O&M person comes in and does do a house assessment for you. And so if you can get involved with somebody through there.
Yeah,
That's
through
what
DDS, the MCB collaboration.
That's what I was trying to come up with, the MCB. I'm so
Yeah,
sorry.
MCB.
Lost my head there. But
No.
but they do a great thing, between their whole, they're
Nice.
just their focus sessions and everything else. But the OCMs are really, they're busy, but once you get them in, and then the Mass Collaborative of the Blind comes in too. Like my daughter actually got diagnosed as legally blind because she has both the cortical visual impairment, but she has a bunch of other things. And the combination of it all, it actually got her that. So they were very helpful in helping us with that.
Thank you for sharing that. That's
Sure.
great that they were helpful. We've been doing some initial work in collaboration with DDS and MCB around CVI, and they're motivated to be like, we need to do more. So
They have a lot of people with CVI too.
yeah.
Yeah.
See,
Yeah. I think that kind of goes into one of the next questions from, is it Mara? Because so many kids are diagnosed late or identified late.
here. Sorry.
Are you aware of any organizations or resources that are working with students beyond 22 for CVI, or any discussions to expand eligibility beyond 22? I mean, I think we can speak a little bit to Massachusetts. I don't know if we can speak to other states though. Those comms services, the orientation and mobility services, the collaboration between DDS and MCB, that's a great way to start. Some of those providers, I believe, are also TVIs as well, just kind of happen to be. But that's a great way to get started. And as Rachel mentioned, we are kind of an initial, collaboration, speaking to MCB and DDS, and we're kind of all coming to the table realizing, after the age of 22, we have these O&M services, which is great. We don't have TVI services. Let's brainstorm. Let's figure out like what are possible options. I think we don't have a solution right now, but I think that's something we all want to look into to see if we can kind of come up with something down the road. So that's to be determined, but it's on our radar. I can say that, and it's on DDS's and Mass Commission, and I think even the ARC right now.
Legislators. Yeah, the ARC. I know this. You guys can help.
Yeah.
But Mara, this is something I just want to speak to Mara, who's an incredible CVI parent advocate. Who's really advocating for expanding eligibility beyond 22. And I think it's something that is absolutely worthwhile because we're all going to need it.
Exactly.
There is a question about the CVI curable. This is a common question we get. It's not, it's a lifelong need, Because it's brain-based, you can see some things change, right? With certain, once you understand the right conditions for you specifically, for the person with CVI specifically to use their vision, you might see like, okay, they're using their vision a little more, like it's a quiet room, they have a blank wall, they're using very familiar items, and they're using vision and compensatory skills all together. But once you take those conditions away, you really see that visual access is still a huge, huge need. And so we can't equate with improvement in a very highly specialized, super controlled environment to, you know, that's going to be the same in all different real world conditions. But yeah, we do see some functional vision improvement in certain areas and aspects, but it's always going to be a lifelong need.
And just to kind of like expand on that, I'm thinking of my son, for example, who when he was little had refractory epilepsy. He had seizures multiple times a day. And so, you know, his vision was really compromised. And then he got a medication that helped his epilepsy and controlled his seizures. And we started noticing he was able to use his vision more. So I think there's so many like internal and external factors. You might see improvement, you might see it get worse depending on what else is going on in that individual's life, if it's a medical situation or whatnot. So, but yes, it is lifelong, unfortunately.
But that's why the diagnosis is so important,
Yes.
because you can make the adaptations to make the improvements that are possible for your individual with getting the correct diagnosis and the correct treatment.
Exactly. Right. And the person with CVI can be empowered to do what they need to do to access their world and define their own success. And so once you know the why behind, you know, what's going on, it can be really life-changing. It's been life-changing for me as a parent once I understood my son's CVI. So
yeah.
I'm gonna butt in again. One other thing
Love
that that we learned with the whole CVI that was kind of life-changing for us was the difference in color when you're feeding somebody. So like a red plate having the mashed potatoes or pasta on it was a huge difference for our daughter to be able to actually see the food on the plate. And that's just a good example I'd like to share with just
I love it.
changes that just once you hear that and it connects to you, it's like, well, of course.
As you know, you know. Yeah, like versus the white mashed potatoes on a white plate. Is that
Exactly.
like,
Just
yeah.
blended right
Same with
in.
my son. Yeah, exactly.
Mm.
The blend right in. Go ahead.
Simple
Yeah.
change with a huge
Simple.
impact.
Exactly.
Yeah.
It starts with the knowledge, with knowing.
Yeah.
And even if you suspect it, it's like maybe start doing some of these things. And if you see it's helping, then that tells you so much, so much more. So, but yeah, it's really simple. We like to use, there's something called bump dots, which are like these sticker raised dots. We put it on the microwave, we put it on the washer and dryer. So he can use all that independently through touch. It's also orange, like, so it's also a nice contrast as well. So there's lots of these different simple things you can do to make adaptations in daily living tasks that are really powerful.
Yeah.
Any other questions? These have been great questions.
Yeah.
Well, I think unless somebody speaks up, I think we've, covered a lot of material. Thank you both, Rachel and Allie, for that wonderful presentation. And thanks to all of you for spending time with us during this busy season. Best wishes for a wonderful holiday and a happy and healthy new year. And I hope to see you again at our next webinars.
Yeah,
Thank you
very much.
all. Be well. Happy holidays. Happy New Year.
Bye.
Thanks.
Thank
Bye.
you.
Thanks, guys.
Thank you. Bye.
Great job.